The effects of the coronavirus still being felt around the world, and that's why we're dedicating time in every newscast today to coverage of coronavirus in Alabama. Most of the state's bigger cities and counties have shown spikes at one point or another of large numbers of COVID-19 cases. That is not the case, though, in North Alabama's Madison County, home of Huntsville. WHNT News 19's Jordan Danis spoke with Huntsville Hospital CEO to see why that area was able to keep its numbers so low.
March 6, Governor Kay Ivey first put together a COVID-19 task force. At the time, there were no known cases of COVID-19 in the state. And in Huntsville, local officials and area hospitals were also coming together to create a plan to stop the spread of COVID-19.
We got together as a group and started researching what was going on in other parts of the world that had a lot of cases. We identified testing as a high priority, and we started trying to get the ability to do testing, working with some lab companies around the state.
Now, more than 3 months later, Mobile County, with an estimated population several thousand less than Madison County, has more than 6 times as many cases. And Jefferson County has more than 5 times the cases. Huntsville Hospital CEO David Spiller says coming together and providing resources and information early and often were key factors in keeping the numbers low.
Talking about how we allocate resources, talking about how we collectively meet the needs of the community. We committed to do it as often as we needed to, and we've met pretty much every Monday during the week, every day. Since this started recently, we've gone to 3 days a week.
Spiller says there were no walls or politics being played, which helped in being transparent in between departments.
I thought the best thing to do in this situation was to make sure people had data and try not to overreact, whether the data is good or bad. Don't get too happy if it's good. Don't get too excited if it doesn't look so good, because we've got to deal with it either way.
Rocket City has many jobs that involve technology. Huntsville employers who move their employees home may have also played a role in stopping the spread.
You had a lot of companies start pretty quickly sending some of their employees home. If they could work from home, you saw a lot of companies do that. They made that decision and they pivoted very, very quickly to do that.
The Arsenal being able to move a lot of their work from home kept all those people from coming together every day. That clearly made a difference. A lot of our other businesses were able to work from home. I think anything you could do to get people, particularly early in the process, back home was a benefit to the community.
The healthcare and government leaders say even though things are starting to return to new business as usual, the COVID fight isn't over yet. In Huntsville, Jordan Daphnis, WHNT News 19.
And Spiller says until a vaccine is put out on the market, the ability to test for COVID-19 will be essential. On WKRG News 5 at 6 o'clock, you're going to hear from the first COVID patient released from a Dothan hospital and how his life has changed since his diagnosis.
Mississippi is opening a grant program for small businesses affected by the coronavirus pandemic. Grants ranging from $1,500 to $25,000 are available to businesses with 50 or fewer employees. The grants can be used for things like rent, payroll, and utilities, but not lost profits. For a link to apply, head to WKRG.com.
And our COVID-19 coverage continues online at WKRG.com. Read about the different forces causing COVID-19 spikes in 21 states. Learn the safety precautions you should be taking if you go swimming this summer, and more on temporary closures of local restaurants due to COVID-19.